Hi, I'm Holly, and this is Jamie, and we are Dementia IQ, powered by the James L. West Center for Dementia Care in Fort Worth, Texas. Jamie, I understand that as the disease of dementia progresses, that all of the senses are affected. Is there anything that we can do proactively to help protect our brains?
Yes, Holly. As a matter of fact, there are many things we can do to be proactive to protect our brains. But when it comes to our senses, there's often two overlooked senses that we just really don't think about. And that's our vision and it's our hearing. Now let's think about it. As our vision and maybe our hearing changes, it is harder for us to hear in crowded restaurants, maybe in a large meeting or even at church. We're sitting in the back row because it's hard to hear, but it's also hard to keep up and maybe follow that conversation because I'm not hearing it as well. Vision's the same. If I can't see as well, it's harder for me to drive at night, so I don't go out as much because I don't want to be driving at night. Or in dark restaurants, again, I can't read the menu. I'm not as aware of what's going on. When that happens to us, what we tend to do is start to kind of withdraw and say, well, it's too hard to go out, so why would I? I just get aggravated because I can't keep up with the conversation. I'm not going to go out. I'm afraid to be asked a question because maybe I didn't hear it or I wasn't able to follow along. So we start to withdraw, and there's some isolation that comes along with that. And we know that isolation is very damaging to brain health and connections just in our lives. But also what's happening is our brain is not getting the engagement. Our brains are designed to stay healthy through use and through engagement. So when we're not engaging them in these interactions and having these conversations with each other, visual cues, problem solving, the brain's getting less and less signals to stay engaged. It comes to that starting to use it or lose it idea. The brain's not using it, it does start to prune away what it's not using. So that can be very detrimental. So think about our hearing and vision as it's not a vanity issue and it shouldn't be a convenience issue. It is a brain health issue. So if you're noticing vision or hearing changes in yourself or a loved one, please go and get those checked out because protecting your senses is protecting your brain.
Thanks, Jamie. Other things that you can do, you can like us. We're going to be here every week and coming back with some more tips for you. You can go to our YouTube page at James L. West Center for Dementia Care and find dozens of videos that are there for you. Thank you.